The number that's been around lately is the median life of a patient with cystic fibrosis is, I believe it's 37. 50% of the patients with CF will die before they're 37. That is what that number means.
I'm going to go over my everyday routine, things I have to do every day, numerous times a day, just so I can stay as healthy as possible and be able to breathe. This opens up my airways, enables the antibiotic, which I do Toby in the nebulizer. Zopanex I do 3 to 4 times a day, and the Pulmozyme is morning and night also. And I take all of my pills right here, either doxycycline, CF'er, and these are also 2 to 3 times a day. Zyvox, Zithromax is Monday, Wednesday, and Fridays. And this is about 3 to 4 times a day. Just swish and swallow. This is morning and night. I also do a sinus wash. Every meal, I check my sugars because I have diabetes from the cystic fibrosis. So before a meal, my routine is I check my sugar. Depending on what my sugar is, I will take the appropriate insulin injection. And then also in the morning, I take long-acting insulin. That's just once a day. I have to drink shakes, supplements, because I don't digest the right amount of calories with every meal. This about 3 times a day. Candy shakes, which is right here. Mix it with some milk, and that's about 600 calories in 8 ounces, so I do that. I take my calcium every day, extra vitamin K because sometimes I have episodes of hemoptysis, which is coughing up blood, especially when I have an infection, are my IV medications. These are very, very handy because, as you see, they're little balls and they're very portable. So when I'm on this, I plug it in right here. This is my PICC line. And it, I can just put it in my pocket, walk around with it. I'm not confined to a pole. 6 to 8 infusions a day, and each one takes about a half hour. Hi, I'm Christina McDonald. I'm 25 years old, and I have cystic fibrosis.
Cystic fibrosis is a genetic disease. It's a recessive genetic disease, which means if you, in order to have the disease, you have to have 1 abnormal gene from the mother and 1 abnormal gene from the father. And what found out in the last few years is that this gene codes for a protein that is in fact a chloride channel. And what I mean by that is you can think of a chloride channel as a gate that sits on the cell membrane that actually opens and closes and regulates the flow of chloride across the cell membrane. When this gene is not working, the protein of course is not working, and chloride can no longer flow across the cell membrane, and water cannot flow across the cell membrane because usually water follows chloride. And as a result of that, on the other side of the cell membrane, the secretions become very, very thick and abnormal. And any organ where this chloride channel is important becomes affected. One of the most important organs that becomes affected is the lung. So secretions in the lung become very thick. Those very thick secretions obstruct the airways. They become infected with bacteria. The most common bacteria are staph and Pseudomonas. And that's why when we treat these patients, those are the antibiotics that we use. Recurrent infections of the lung, recurrent inflammation, cause lung damage, and as a matter of fact, the majority of patients with cystic fibrosis will die of respiratory failure. But other organs are affected as well. The pancreas, for example. Pancreatic ducts become obstructed with these very thick secretions. Pancreatic enzymes are released within the pancreas, and they actually destroy the pancreas. So a lot of patients with cystic fibrosis are born with no pancreatic functions, and that's why they require pancreatic enzymes as a supplement so they can eat properly and they can gain weight. The liver, the bile becomes very thickened, and a lot of these patients have liver abnormalities, although in most of the cases the liver abnormalities are mild. The sinuses are also affected, they become obstructed, and these patients suffer from acute and chronic sinusitis. The vas deferens in males become blocked and they don't develop normally. As a result, the majority of males with cystic fibrosis are infertile.
My name is Fatma Jaffrey, and I'm a physician at the Long Island Jewish Hospital. Over the last year, my team, consisting of physicians, nurses, social workers, case managers, respiratory therapists, pharmacy, and dietitians, have been working together to understand how well we care for our cystic fibrosis patients. In late 2008, we received a letter of complaint from a family of a cystic fibrosis patient who had miraculously delivered a baby girl in our hospital. The delivery itself was seamless. The overall care around her cystic fibrosis was poor. She had to wait up to 13 hours to receive her breathing treatments. She did not receive the insulin she needed to be able to eat snacks or her meals. And that in general, her family felt that they were a burden on their caregivers. Subsequently, we assembled a team to uncover and to begin to study how well we take care of these cystic fibrosis patients. And what we learned was shocking and astounding to us. We learned that up to 80% of the time, our cystic fibrosis patients do not receive the enzymes they need to be able to eat snacks or meals. We learned that they can wait anywhere from 24 to 36 hours for their first breathing treatment after being directly admitted to our medical unit. We also learned that in general, these patients felt that those caring for them did not understand the burden of their illness or how to deliver care well. This video comes after a year of work and an understanding not only what the patients perceive of the care that we provide, but also the experience of those providing care. We hope to provide you with valuable knowledge and some skills that you can develop to be able to deliver the best care possible for every cystic fibrosis patient, so that every one of our CF adult patients admitted to our hospital get the right care at the right time.
Typically, a patient with cystic fibrosis is admitted directly through the admitting department. They may also come through the emergency room. The doctor will make a phone call to the admitting department and secure a bed for the patient. The patient then arrives to the hospital and is escorted to the room. Most often, patients with cystic fibrosis are admitted to 5 North. We do not cohort these patients because of their high susceptibility for infection. Upon arrival to 5 North, the patient will be seen initially by the nurse. The medical admitting resident, or MAR, is called and the orders are written. It is important to determine if the patient is in need of oxygen or a respiratory treatment on arrival. If so, the patient should receive it immediately. A cystic fibrosis toolkit is available for our convenience, easily located in the nursing station on 5 North. It contains all the necessary forms, order sets, and consents for the self-administration process. Eventually it will be electronic, but for now it will remain in the toolkit. When writing admitting orders, please remember that CF patients are experts in their own care. They know their medications best, and we need to carefully reconcile their medications with them and include them in the process.
One thing that's, a big concern about being in the hospital is getting my treatments on time, getting my correct medications. When I'm at home, I'm just so used to doing everything when I need it, like by myself. I can pretty much do it in my sleep. I need to do a treatment, I get it. Being in the hospital, it's sometimes always scary because you don't know, if you don't have the control of taking your own meds, you don't know when the nurse is going to come with your pills. You don't know if when you get admitted, you're going to be waiting 10 to 12 hours for your first bronchodilator. It's crazy. And, you go to the hospital to get taken care of, and I feel like, you shouldn't be walking into the hospital being scared that you're not going to get taken care of properly. You're there to get better. So I think that being able to take your own meds by yourself, having them in your room with you, as long as you're doing it and writing it down and doing it correctly, I think that's a very, very beneficial thing for cystic fibrosis patients.
When the cystic fibrosis order set is used, we've learned through studying every patient admitted that their time to receive their breathing treatment is cut to less than 2 hours. We've also learned that when self-administration is used for these patients, their experience in the hospital dramatically changes, and patients are 100% satisfied with the care that they receive.
My role as a primary nurse taking care of a CF patient with self-administration would be to oversee the proper completions of order sets, signed consents, transcribe to the blue MAR, and answer any questions that the patients may have about their care, as well as educate. The blue MAR would be kept in the patient's room on top of the medication box. This MAR contains the name of the medication, the dose, the frequency, and self-administration medication only. The patient would put the time of the medication was taken, the amount, and sign their initials. It is the RN's responsibility to make sure the patient is taking all of their medications, as well as keep an inventory of needed quantities at the bedside and requesting any additional medication that is needed. This workflow is essential for the success of a CF patient and self-administration.
I would have to say one of the hardest things about having cystic fibrosis is the unknown. Just not knowing when you're gonna get so sick, when things are just gonna take that turn for the worse. Knowing that CF in itself is a progressive disease. I'm very scared because a lot of the antibiotics I'm on, I'm becoming allergic to. My body is building immunities to them. I know eventually I'll need a lung transplant in the future. I have quite a few, more than half of my friends with cystic fibrosis have had lung transplants and have been very successful. I have a few friends who have had lung transplants and then went through rejection and have passed away, so it's scary seeing that. And then I have a few friends who have just been too sick, never got the lung transplants, and have passed away.
Our self-administration process involves the pharmacist filling a medication kit upon admission or at any time a patient agrees to self-administer based on prescriber's orders. The medication kit contains all the medications that a patient will self-administer as it was specified on the order set, and can include bronchodilators such as albuterol and ipratropium for nebulizer treatments, inhaled corticosteroid such as Advair, mucolytics, hypertonic saline, and Pulmozyme, inhaled antibiotics such as Toby, and pancreatic enzymes and vitamins so that patients may eat whenever they feel like it. Once the medication kit, intravenous antibiotics, and all other medications are ready, pharmacy and nursing will deliver them to the unit. The medication kit is stored in the patient's room. The kit has a lock with a combination which needs to be locked at all times when not in use. Upon discharge, the nurse will remove all medications from the medication kit, send them down to the pharmacy, and send the medication kit to Central Sterile for cleaning. Once Central Sterile cleans the medication kit, we'll contact the pharmacy for the pharmacy to pick it up. If you have any questions regarding self-administration, you can call the pharmacy at any time, or you can call your clinical pharmacist to help you out with medication histories.
Imagine if before every morsel of food you eat, you must take medication just to digest the simplest of foods. For a patient with cystic fibrosis, this is a daily obstacle they must incur. Because some CF patients are pancreatic insufficient, it is important to understand that pancreatic enzymes may be blocked from getting to the small intestine. This leads to poor metabolism of food, which may lead to weight loss. Pancreatic enzymes should be taken before, during, and after meals to maximize absorptive qualities. Enzymes are needed with mostly all meals and snacks. It is also important to maintain a high caloric intake with balanced portions of fat and protein, as well as salt and fluids, which are especially important during times of sweating. Double portions are a measure taken to help meet caloric needs for CF inpatients. Calories are important in maintaining weight and helping to fight infection. When patients have a pulmonary exacerbation or infection, their caloric needs further increase. For cystic fibrosis-related diabetes, a diabetic diet is not warranted due to the high caloric demands of a CF patient and is thus managed with insulin. Be sure to test blood glucose levels before meals and to provide insulin prior to eating to aid with blood glucose control.
After months of rigorous testing of this order set, revising it, and studying the results, we were able to decrease that initial 29 hours that it took to get our patients their first breathing treatment to less than 2 hours. We have sustained that time for over 6 months now for every patient who's admitted to our hospital with cystic fibrosis exacerbation. We also learned that we've been able to decrease the time that it takes to deliver their antibiotics to less than 4 hours. The self-administration process that's been put into place has dramatically changed the experience for our patients as well. They have control over their own medications, and they're able to take them at the routine time that they take it at home.
As a respiratory therapist, it is our job to educate patients with cystic fibrosis the importance to keep the lungs clear of mucus buildup to maintain lung function. With CF, the cilia which move the mucus in healthy lungs are thickened and less effective. Clearance techniques loosen the mucus in the lungs and airways so it can be coughed up. This keeps the mucus out of lungs to improve breathing and reduce infection. There are several options for airway clearance. Chest PT, or chest percussion, which involves another individual to perform, is where the chest is clapped and vibrates to dislodge and move mucus. All parts of the lungs can be drained by performing this in varied positions. The vest is an example of high-frequency chest wall oscillation, which can be done without an assistant. An inflatable vest is attached to a machine that vibrates at a high frequency. This should loosen mucus and the patient coughs.
Just shaking me right now.
Positive expiratory pressure, or PEP therapy, involves a mask or mouthpiece attached to a resistor. The person breathes in normally and breathes out a little harder against the resistance. The PEP techniques offer the advantages of low cost, effective removal of secretion, ease of use, and patient self-administration. Examples of PEP therapy devices include the Acapella, the Flutter, the Quake, and the TheraPep. In addition to these treatments, physical exercise may help with airway clearance. If they do not have a regular exercise regimen, patients are recommended to join a pulmonary rehab program. This program will educate the patient on how to exercise properly while loosening the mucus, making it easier to cough. It also builds strength and endurance of the breathing muscles and increases the overall fitness of the cardiovascular system. It is our duty to administer patient nebulizer treatments on time. In addition, we need to maintain pulmonary hygiene, clean out the nebulizers properly, and remind patients and yourself the importance of hand hygiene and infection control. As a respiratory therapist, communication with the CF patient is key. It is beneficial for the therapist to communicate with the patient what medications they prefer, the time and routine of treatments, and the preferred method of airway clearance. This will assist in getting the patient to recover faster and improve the quality of the patient's hospital stay. These different treatments help make each day a little bit easier. Respiratory treatments can help prevent infections and overall slow down the progression of cystic fibrosis.
They're coming to the hospital because they need this to be stepped up. They need the hospital professionals to do things even better than they've been doing at home. In the hospital, the nurses, the doctors, everybody combined can give them what they need so they can rest. They are afraid of what may happen if the treatment in the hospital is not sufficient. Every single one of them have friends their age or younger who have already perished from this disease. It is frightening to them. They are afraid to catch more bugs. They are afraid to be away from their family. They're afraid of the future. These patients may not look that sick on the outside. They may look perfectly healthy, but if they are in your hospital, under your care, they are not. If they can't breathe, they need oxygen. They're taking the bronchodilators, they're taking the steroidal inhalations, the diabetes, insulin. It's so encompassing, and the help and care that they have to be given and understanding from healthcare professionals. They're not whining, they're afraid. If you take one thing away from this video, right, it is the importance of getting it right. Cystic fibrosis patients are very needy. There is a lot involved. Their life depends on the treatment being the best it can be. Your care, treatment, expertise, understanding can change the outcome and have a better future for these patients with cystic fibrosis. You can have these people feel comfortable, safe in your hospital and under your care, as well as their family, right? It is horrible being a parent of someone you know that is very possibly going to die.
I know with just a little bit of change and effort, we can change the experience for every cystic fibrosis patient when they come into the hospital. Thank you so much for watching.
Mommy's on oxygen.
What does this help mommy do?
What is that?
Helps mommy breathe.
Aww.
Yeah.
Does that help mommy breathe?